everyone. We are Lauren Shia, Allie Blakey, and Elizabeth Mayo. Today we're tackling a topic that impacts almost every Oklahoman: budget cuts. We'll focus on how these cuts affect three key areas of our lives: healthcare, transportation, and education. We'll also explore potential solutions and how our community can help.
As students and Oklahomans, we aim to shed light on these challenges and discuss how better financial planning and stronger community ties with government officials can lead to positive change. By improving financial management and encouraging government engagement, we can mitigate these budget cuts' effects and work towards a more supportive environment for all Oklahomans.
Oklahoma's budget cuts have harmed education, healthcare, and transportation. Addressing these issues requires strategic financial planning and improved connections between officials and the community. We will explore the impact of these budget cuts on healthcare, transportation, and education, and then discuss ways to address these challenges for a better Oklahoma. Let's start by defining the problem and analyzing how these budget cuts have affected healthcare access, transportation reliability, and educational quality, and then we will look at some possible solutions.
Oklahoma's healthcare system has faced significant challenges due to state budget cuts. These cuts have led to a range of negative impacts, including reduced access to care, decreased quality of services, and increased financial strain on both providers and patients. Let's dive into how these cuts have affected three crucial areas: healthcare access, quality of services, and financial stability. Firstly, budget cuts have severely impacted access to healthcare in Oklahoma. One of the most noticeable effects has been the reduction in Medicaid funding. Medicaid is a vital program that provides healthcare coverage to low-income individuals and families. According to a report by Aviva Aaron Dine, Kyle Hayes, and Matt Broaddus in 2020 from the Center on Budget and Policy Priorities, the need for Medicaid is rising, but the program is at significant risk for cuts due to budget constraints. Quote, Oklahoma reports total Medicaid enrollment without specifying how monthly enrollment is defined. Enrollment is up 6.1% between February and May, or 47,936 people, end quote. This information was presented in July of 2020 as COVID-19 and unemployment rates were both rising. These cuts to Medicaid funding have resulted in fewer resources for healthcare providers and limited access to necessary medical services for patients. Many healthcare facilities have been forced to close or reduce their services due to insufficient funding. This has left many Oklahomans without nearby medical care, forcing them to travel long distances for care or treatment or forego care altogether. Additionally, the quality of healthcare services has declined due to budget cuts. Hospitals and clinics across the state have had to make difficult decisions to cope with reduced funding. This often involves cutting staff, reducing hours, or delaying investments in new equipment and technology. According to KOSU, a public radio station operated by Oklahoma State University and an NPR member station, 37 of the 78 rural hospitals in Oklahoma are at risk of closing due to financial pressures. That is 47% of rural hospitals. This has a direct impact on patient care as understaffed and under-resourced facilities struggle to meet the needs of their communities. Patients may end up experiencing longer wait times, reduced access to specialized care, and just overall lower quality of treatment. The National Conference of State Legislatures says that, quote, more than 60 million Americans live in rural areas, and generally they tend to be older and in poorer health than those living in a city, end quote. They also proceed to state that in the last 18 years, 195 rural hospitals have either completely closed or converted to emergency or outpatient care only. Oklahomans depend on affordable and accessible health care, and by not providing it, we increase the health problems and overburden emergency services. Lastly, budget cuts have placed a significant financial burden on both healthcare providers and patients. Healthcare providers, including hospitals, clinics, and individual practitioners, have seen their reimbursements from state programs like Medicaid decrease. This has led to financial instability for many providers, forcing some of them to close their doors permanently. For patients, reduced funding often means higher out-of-pocket costs for medical services and medications. According to the Oklahoma Healthcare Authority's May 2024 report, approximately 1.4 million Oklahomans are enrolled in Medicaid and Children's Health Insurance Program, or CHIP. This indicates a substantial reliance on these programs for healthcare coverage in the state. However, nearly 14% of Oklahomans remain uninsured, and many more remain underinsured. This financial strain caused by budget cuts worsens the issue, making it even harder for individuals to afford necessary health care. This situation underscores the importance of maintaining and even increasing funding for Medicaid and other healthcare programs to ensure that Oklahomans have access to all the medical care they need. Budget cuts have had a ripple effect on public health initiatives and preventative care programs. Public health departments, which play a crucial role in disease prevention, health education, and emergency preparedness, have faced significant funding reductions. This reduction hinders efforts to address health disparities, control diseases, and respond to health emergencies. Preventative programs like vaccinations and health screenings are often cut first, harming community health in the long run. In conclusion, state budget cuts have severely impacted Oklahoma's healthcare system, reducing access to care, diminishing service quality, and increasing financial strain on patients. Nearly 1.4 million Oklahomans rely on Medicaid and CHIP, yet budget cuts threaten these programs, leaving many uninsured or underinsured. To address this, we need to increase funding for these vital programs, we need to prioritize preventative care, and we need to invest in telemedicine and improve access, especially in rural areas. Strengthening partnerships between government officials and community organizations can help tailor solutions to local needs, while increasing transparency and accountability in healthcare spending ensures efficient use of resources. By taking these steps, we can work toward a more sustainable and supportive healthcare environment for all Oklahomans, reflecting our commitment to the well-being of our state's residents.
Educational budget cuts affect not only this generation, but future ones as well. Lower spending in schools results in lower pay for teachers. This means that some of our best teachers are going to relocate to other states and other places in search of a better quality of life. In a 2022 article by Alex Cameron with News 9, State Superintendent Joy Hoffmeister shared that until we address our teacher shortage by giving competitive compensation for our teachers, we are not going to be able to provide the needs for our children. Other issues include out-of-date textbooks and larger class sizes. Obviously, with out-of-date textbooks, our students are not going to have updated information, and they're not going to have the same information as other students. So they're automatically going to be behind other classes, other states, and they're going to be at a major disadvantage. All of this leads to lower achievement for students. A 2024 article by Walden University cites a study that found spending cuts meant a lower achievement for students across the board. Cutting a school's budget by only 10% has the same effect on test scores as replacing a school full of average teachers with all teachers in the bottom 10%. So as you can see here, it's $160 less per student since 2015. That means fewer art programs, fewer athletic programs, and fewer classroom supplies. This greatly affects students' futures. When they want to focus on a sports or get a scholarship, or anything like that, they're not going to be able to do that because it's not going to be supported. As you can see in this next graphic, as said by Jerry Needham, which is a Octaha Public School Superintendent, we are balancing budgets on the backs of students with increased class sizes, curriculum loss, and the loss of school days. More than 100 districts are considering a 4-day work week, and others are planning to shorten the school year. That also means fewer educators. More than 1,000 school jobs may be eliminated the next school year. So why should we care about all this? Because it has far-reaching effects. Karabo Jackson with the Northwestern Institute for Policy Research explained in his 2017 article that an increased spending rate per pupil leads to a rise in graduation rates and boosts adult income. That means that with increased spending, we're not only going to get better pupils, better students, we're also going to have better adults, which means we're going to have a better community overall. So how do we go about changing this? So one way you can make a change is to find your legislators online and talk to them. Let them know you want them to prioritize education funding over tax cuts and tax breaks. Learn more about the policies that are currently in place. We can't do anything until we know how everything works right now. Once we know more, we need to share that knowledge with our community. Share it with your friends, share it with your family. Because we can't make a difference until someone steps up and decides to make that change. And then we can all band together and move towards a better Oklahoma.
Imagine a state where every journey, every commute, every shipment hinges on the strength of its infrastructure. Now picture that infrastructure is strained and limited by budget cuts. Cuts that impact our roads, bridges, and transit systems right here in Oklahoma. Today, we gather not just to discuss the financial implications, but to understand the profound effects these decisions have on our daily lives and our state's future. Budget cuts can affect citizens' everyday lives. Traffic congestion, safety, and long-term effects when the jobs end up taking longer. Budget cuts happen to the transportation system because the process of fixing infrastructure is a long and expensive process. Fixing roadside or bridges can take a long time and use many materials, so a lot of money can go to that one project. But when you think about the whole state of Oklahoma, that is a lot of long processes. Also, a lot of times, the transportation system, along with many others, kind of gets thrown to the back when bigger things need the money. Traffic congestion occurs in especially bigger, heavily used roads. This can cause a number of things like heavy wear on the road, a demand for road expansion, and an impact on roadside efficiency. With cars using the main highways, bridges, and roads, this causes them to deteriorate faster and then need to be fixed faster. With heavy trucks driving on these, it does not take long for a road to start having bumps and holes, especially when there are thousands of trucks driving on it daily. Because these areas are so congested, there's always a need for expanding areas along the road to make everything flow smoother. This is a graph showing the most traffic-heavy highways in Oklahoma. Without expansion, it would take hours to get from point A to point B, especially if you get caught in standstill traffic on the way. This leads me to my third point, efficiency. Keeping Oklahomans happy with the road is also on the list. Looking for ways to improve road quality to make it easier to get where one would be going. This is important because this is what it comes down to, is making people happy and keeping them safe while doing so. I know road work is not the greatest at times, but it is needed. But with budget cuts, this may not happen how we would like it to. Having worn down structures is also a safety hazard. Collisions can happen if there is not enough money in the budget for road signs, lights, or inadequate infrastructure, leading to wrecks. Not being able to fix roads can cause wrecks and be deadly to motorists driving on the roads. Investments in safety enhancements, like adding guardrails, improving visibility at intersections, or installing barriers, may be postponed or pushed back due to budget constraints, potentially compromising safety measures. This is a graph showing how many accidents happen because of poor infrastructure. Addressing safety concerns in transportation requires adequate funding, proactive maintenance practices, and investments in safety measures to ensure the well-being of all road users and transit passengers. Long-term projects can create long-term effects on the budget. Working on a specific project for a long time because of budget cuts can create a more expensive project due to the rising of prices because of inflation. This is an easy graph to look at, showing that inflation is causing problems with road work and the building of better infrastructure for Oklahoma. The prices have increased this much in this amount of time. This can make a certain project take even longer due to not being able to get the materials needed. Having an appropriate budget and timeline is needed to be able to complete these large projects all around us. In conclusion, the impacts of budget cuts on traffic congestion, safety, and the long-term health of our transportation infrastructure are clear and concerning. As we navigate these challenges, it's crucial that we recognize the interconnectedness of transportation with our economy, environment, and our daily lives. Advocating for sustained and increased funding for transportation infrastructure is essential to meet the growing demands of our communities and our economy.
As we come to a close, it's important to remember that these issues affect us all, and while we can't fix everything overnight, we can start moving in the right direction. Today, we discussed healthcare, transportation, and education. So whichever speaks to you most, find your voice and make a difference.
By planning finances better and encouraging government officials to engage with the community, we can lessen these negative effects and work towards a more sustainable and supportive environment for all Oklahomans.
A Chinese philosopher gave us the famous saying, The journey of 1,000 miles begins with one step. So let's take that step today.